Good morning, everyone. I am Dr. Suboohi, consultant obstetrician and gynecologist, and a fetal ultrasonologist. My main passion is fetal ultrasounds. Now, I'm practicing in Gurgaon for the last 17 years, and I have got my own mother's clinic and ultrasound center. The idea of this video is that because I'll be telling you about level 1 ultrasound and how it is not the first ultrasound that is called the level 1 ultrasound. So first ultrasound is an ultrasound which is done between 6 to 8 weeks of pregnancy to see exactly how your baby is, where's the location of the sac, is the baby viable. That is the first ultrasound. But level 1 ultrasound is different, and it is like done between 11 to 13 plus 6 weeks. Like it cannot be done at less than 11 or more than 14 weeks at 15 weeks because then the markers will be lost. And why was it important? So previously what happened that people who were like pregnant ladies who are more than 35 years of age were subjected to invasive tests like chromosomal, like chorionic villus sampling or amniocentesis to rule out Down syndrome or any other chromosomal anomaly. But later on, they recognized that a lot of people who were younger also had babies which were not chromosomally normal, and they were left from screening. So only 15 to 20% of the population was screened, and the rest of the population had fetuses like 1 in 20 or 1 in 33 that were not chromosomally normal or had some amount of deficiencies. So the level 1 ultrasound, what it does is that it does the screening for the markers to rule out chromosomal anomalies like Down syndromes and trisomy 13, trisomy 18, as well as to a large extent it can see structural anomalies also. So I'll be telling you in brief what exactly does a level 1 ultrasound does. So basically it should be done by a person who is fetal medicine certified or any other person who is into fetal ultrasound with passion. So that is how they can be actually updated about the looking for the markers of chromosomal anomaly. So what they saw was that there is nuchal translucency they have to see, and that is like the collection of fluid behind the neck of the fetus that can be seen by ultrasound in a proper way. And then they realize that if they integrate the maternal age, the fetal heart rate, and the nuchal translucency, they can come up to telling the pregnant lady the risk of having Down syndrome. But then later on, they came up with newer markers like nasal bone. Like they can see in the fetus the nasal bone, and they see if there is an absence of nasal bone, there is an increased likelihood of this fetus going in for chromosomal anomalies like Down syndrome and other problems. At the same time, they realize that there is a connection called Ductus Venosus. So if you see the Ductus Venosus and there is a flow that is forward, then that is called a good baby. That is what we want actually. But if there is a reversal of flow, again the chances increases of having this fetus having chromosomal anomalies. And then they notice there is tricuspid regurgitation. There is another marker, and they see the fetal heart. And if there is a tricuspid regurgitation, this fetus is again at a higher risk of chromosomal anomalies or structural anomalies of the fetus. So coming from the later scans, like initially the scans like were done at around 16 to 18 weeks, 18 to 20 weeks, they have decreased the age, and they say that level 1 should be done at this time so that they can pick up not only the chromosomal anomalies but the structural anomalies that we can see the 4 chambers of the heart well, we can see the stomach bubble, we see the urinary bladder and the umbilical arteries, and we see the fetal legs moving and the hands moving, and we see if the limbs are all complete, the spine is all proper. So all these analysis, the shape of the head, is it round or is there any deficiency? So the basic idea of all the obstetricians, the gynecologist and the sonologist is to catch up as early as possible any defect in the fetus, and so that proper counseling and management can be taken care of by the doctors or by the counselors, and they can just do the and the mother and the father are best guided for the course of action they have to take care of. And the other thing is about the level 2 ultrasound, which I'll be telling you about in the next video. And thanks for watching this one. If you have any queries, you can always call me up for that. Thank you so much.